All right, welcome back, everybody. Here's another training for spicing up your skills with Regina and Infinity today. So, why do you look so tall? And why do I look so
Well, it's because I'm
short?
sitting on a pillow to
Eating?
help my back.
Oh, well, I want to be tall like you.
Do you want the pillow?
No.
Okay.
There's another one over
I
here
have to,
somewhere.
otherwise I'll just be like switching hips every
Right.
second.
All right, so today we're going to talk about congestive heart failure because this affects a lot of our folks. And we don't want you guys to be, again, just we want you to be confident in your skills, confident in your knowledge. You're not offering medical advice, things like that, but it's still good for you guys to have the information so that you understand the background of what somebody's dealing with. And we are a chronic disease management company. It's one of the benefits of Sugar and Spice, of having nurse oversight. And so I want to share the knowledge that I have with you guys so that you really feel a lot more just, educated and knowledgeable about what you're dealing with some of our folks. So one of the common things in our chronic disease management bucket of diagnoses is congestive heart failure.
So
So we're going to
what,
talk about that.
oh, sorry. What is congestive heart failure?
So it's basically called that because it's when the heart is failing to pump like it should, and it's affecting the body in different ways, and blood and fluid back up in our circulatory system and causes congestion. So it's congestion into the lungs, congestion into the body. You got edema, you got sometimes your liver, and what was the other one they just were talking about?
Kidneys?
Um, might be kidneys. Some of the organs can start to swell up too and build up fluid around
Mm,
them. So that's where the congestion part of the heart failure
okay.
comes in. Yeah.
So what causes someone to develop this?
So it's usually a long year's worth of problems that accumulate into the heart failing. So it can be chronic high blood pressure. It can be like arteriosclerosis, or atherosclerosis. It's just where the vessels are starting to get filled up with plaque, or our blood vessels just become more stiff and not pliable. They don't respond like they should. There can be the result of maybe a previous heart attack on the heart, and so it's just not able to pump, or
Hmm.
that part of the muscle of the heart isn't working anymore. It could be a valve issue. If there's a faulty valve that's leaking, it's not pumping properly, the heart's getting tired. There can be other things that can lead to it. If the person has had like smoking, if they've smoked, that can lead to arterial disease. Um, and then I don't know, let's see if I can, I'll go into it here in a little bit, like the different types
Okay.
of congestive heart.
And so you talked about this a little bit with the edema,
Mhm.
but what are some other common symptoms that caregivers should expect to see?
Yeah. So maybe I should explain like what happens in congestive heart failure. So the left side of the heart is responsible for pumping blood out to the body. Okay. The
Hmm.
oxygenated blood goes out through the left side of the heart. So the left side of the heart, if it is struggling, then it's not going to be pushing the amount of blood out of it, or it's not going to be pushing with the force that it needs to. There's a couple of different things that it can affect. So then perfusion to your organs is going to be decreased. Um, a lot of times what happens is the problem shows up first on the left side of the heart, and then it starts to affect the right side of the heart. So then you can have um systolic heart failure, which is the right side, or you can have diastolic heart failure, which is the left side. And um when the right side of the heart starts to fail, that's really where you see a lot of that backflow into the systems.
Okay.
So that's where you're going to see fluid starts to accumulate in the feet and the ankles. Lots of, you've probably seen so many of our folks have swelling in their feet and ankles. Um, you might also see them start to become short of breath because that fluid's going to back up into the lungs. And so now the alveoli, which are the little air sacs that are responsible for exchanging of oxygen and carbon dioxide, now have fluid hanging out in them like little puddles. And so that oxygen carbon dioxide exchange can't happen effectively like it's supposed to. Um, and so then they can have, like, when we listen to their lungs, it sounds like crackles in their lungs. They might have a cough. They might have a productive cough and it's like frothy and maybe have a pink tinge to it from actually having blood in it, a little bit of
Oh,
blood mixed in with it. Um, there can be short of breath for sure, obviously. This is why some of our congestive heart failure patients are on oxygen. Um, and then there's other things that doctors will prescribe to try to help with their symptoms.
okay. And so, what are some early warning signs that a client's congestive heart failure may be getting worse?
So, the very, very, very first sign is a weight gain. We might see them gaining water weight before we see them actually develop a symptom.
Okay.
So one of the things that's super important for every congestive heart failure patient is that they need to be weighed every single day. Usually it's in the morning wearing either this a similar t-shirt that they wear every time or a similar weight of nightgown or just naked. They usually pee and then they will weigh themselves. So that way we have an accurate day-to-day weight. So you're going to want to make sure if that is part of their plan that we are writing that down. We'll have a place for that to be documented every day. They may have a spot like in the bathroom on a notepad or something that they're recording it to if we're not there, but I still want that information transferred onto our worksheet. And then the other thing that we're going to watch real close then is from their baseline weight. So let's say we got a little lady and she weighs her baseline weight's 125, right? So then if we get there and today she weighs 123, then that's a problem. And we are going to assume that she has 3 extra pounds of water weight that she's holding on to. So, if she hasn't already, she might be starting to have some shortness of breath or just be really weak and tired, and especially with activity. So we're going to watch for that. That would be the main thing. And then, of course, just watching for the obvious shortness of breath, feeling like she can't catch her breath, requiring more oxygen, increased swelling in the ankles, things like that. But the very first one just is measurable. So I like that one because it's not just, oh, I don't feel as great today because maybe I didn't sleep well, or maybe I
Hmm.
didn't eat, or maybe there can always be all these extenuating circumstances. But
Yeah.
I like the weight because it's measurable and we can see from day to day if they are gaining or losing weight.
So, what if it was just 1 pound?
If it's 1 pound, it's okay. Usually the doctors will say we're going to do an intervention if it's over 3 pounds.
Okay.
And then we might do another intervention if it's over 5 pounds.
Okay. So, when would a caregiver call the nurse and when would they call 911?
So I would say if they are just like kind of I was describing, they feel a little bit more short of breath, they're having a hard time finishing all their sentences without stopping and taking a break. Um, they're more weak, things like that, we can try to do some interventions. We can maybe have them take an extra water pill, like a diuretic, if they have
Okay.
one, or we can monitor their salt intake that day and make sure that their sodium's low and they're in their parameters. And then, you know, sometimes there's a water restriction, like they're not allowed to drink over a certain amount of water. So we
Mhm.
can start monitoring that day and maybe be a little more corrective and try to get it back on track. But if you get there and they're like, tripoding on their hands, they can't catch their breath, they're turning blue, they can't hardly say a word or two at a time. they're on the floor, whatever. Obvious, all those are emergent um, signs and symptoms of severe respiratory distress,
Yeah.
chest pain, then call 911.
Okay.
Yeah.
And what are the biggest priorities when caring for someone with congestive heart failure at home?
The biggest priorities are just to maintain because we want our folks to stay home, right? We don't
Yeah.
want them going to the hospital. So that revolving door to the hospital happens when they are not taking their medications, they're not measuring their weights, they're all over the place with their salt, they're eating whatever the heck they want. Maybe they're drinking 10 glasses of coffee and
Yeah.
lemonades and so whatever those doctor's orders are, whatever those restrictions are, we need to be aware of those, which we will be, right? Because we're going to do that intake with them and get all those instructions. Um, but yeah, just monitoring them, helping them stay in line with their orders. I would say some exercise is good. I think that's one of your questions,
Hmm.
but some exercise is good, but I wouldn't, these aren't the folks that we're really pushing because their heart is at a point where it's not going to recover with exercise.
Hmm.
It's just maintaining at
Okay.
this point. It's really not, um, it, in most cases, it's not reversible and can't be fixed. So then we're not gonna do things to make it worse, right? And
Okay.
overload them with activities. So things to be aware of are just their limitations. Make sure if you're going out with them, you're bringing the wheelchair, you're bringing the walker, you've got the oxygen, you got the extra oxygen, you got the let's see, you're aware of their water intake for the day, things like that that are gonna come into play.
So would you want someone with congestive heart failure to keep their head elevated at all times above their heart? Does that make a difference at all?
Yes, because if you go back to the what I was saying about the fluid building up in the lungs, it if they lay down flat, sometimes that makes it harder to breathe
Mm, okay.
than if they're sitting upright. So if
Right.
you've got somebody that's really struggling, you won't, other people are going to want to be like, I got to go lay down.
Hmm.
I don't feel good. I want to lay down. But yeah, elevating their head is really helpful. And a lot of people with congestive heart failure will actually like sleep in a recliner
Oh, okay.
because it feels better to them. Or they'll have one of those pillows that's like a big wedge, that they can sleep on at night, put their pillow on top of that. That helps keep their head elevated.
Okay.
Yeah.
And what should caregivers know about medications?
Well, we'll have the medication list there and we'll go over that with you, but I think that pretty much all congestive heart failure patients are on some kind of a diuretic for, man, look how tiny I'm getting. I leaned back and I got like all tiny.
I'll lean back more.
I feel like a little person. I already
Hello.
sound like a little person. Now I look like a little person. Um, what were we talking about? Oh, meds.
Yeah.
So yeah, they're gonna be on a diuretic probably. So side effects of diuretics are low blood pressure because you're
Okay.
peeing out your fluid, right?
Hmm.
So you're emptying your tank. So then your pressures can also tank. Then they might get lightheaded. They might have where they stand up and the room goes black, or they stand up and they get really short of breath.
Hmm.
So that might be a low blood pressure issue. Also, a lot of diuretics, especially Lasix, is considered a non-potassium sparing diuretic, which means that when your kidneys are peeing out a bunch of fluid, a lot of your potassium is going to go right out with it. And
Okay.
then you can have dangerously low potassium levels. So if somebody's on Lasix, they should also be on a potassium supplement. Um, Signs of low potassium can be cardiac dysrhythmias and a lot of muscle cramps, things like that.
Mm, okay.
So that's just diuretics. Some diuretics are potassium sparing, so then they are better at that you don't have to take extra potassium. But I would say that congestive heart failure is usually not alone. There's usually some other issues that are going on with this person. It's not usually just congestive heart failure. Maybe they're maybe they've been a smoker, maybe they're overweight already, maybe they already don't have a good diet, maybe they have some kind of mobility problems. But along with congestive heart failure, you can think about it like it's going to be a trickle down effect, right? It's if it's causing edema and now you're carrying around extra weight in your ankles. Now you're going to feel weaker. You're going to feel like you got little ankle weights on your feet
Mm-hmm.
everywhere you go. So then it's going to take more energy to take those steps through the living room than it would if you didn't have that. Now you're putting extra strain on your heart and your lungs and everything to try to keep up with carrying weights around with you everywhere you go. So
Right.
then that's going to just kind of be a cyclical effect of this leads to this, leads back to this.
Mm-hmm.
Um, the other thing that can happen is as the heart just gets weary and worn down, sometimes it affects the electrical activity of the heart based on what's going on with it. So then they might have a pacemaker. So now you got somebody whose heart is already struggling. Now they've got something that electrically sets the pace for the heart so that it can beat efficiently. But what happens when somebody goes on a pacemaker? Now they probably are on a blood thinner, right? Because now they're got this device in their heart and they might be prone to developing little clots, which can cause a stroke, which can cause
Jeez.
a
Yeah.
blood clot in the lungs, which can, so then we got to watch for blood clots. So now they're on a blood thinner. Well, now they're on a blood thinner. So now they have other issues, right? Because now their increase for falls goes way up because somebody who falls and bangs their head and is on a blood thinner now can have a brain bleed, right? Because it's going to extend the amount of time that it takes for the blood to clot. Same thing with bumps and bruises. They might be just covered in little bumps and bruises. If they get a skin tear, you're going to have to hold pressure on that way, way longer than you would somebody who's not on blood thinners. They're going to be prone to nosebleeds. So then there's like, things that we watch out for with people that are on blood thinners, like bleeding gums and things like that. Um, so yeah, and then they might be on oxygen now, so then you have the added effort of managing the oxygen
Mm-hmm.
and not letting them trip over all their little cords that are running, all their little hoses that are running through the house. So that's all I mean is just like one thing's going to probably lead to another, or
A
they're going to
million.
all kind of come together at the same time, and so they might have a whole pile of stuff.
Yeah.
Yeah.
So, question about if the client gets shorter of breath while the caregiver is there and they are already on oxygen, are they allowed as caregivers to turn up their oxygen to rescue them or no?
Yeah, yeah, I would say that would be you're going to call the office and I'm going to say turn it up, have them sit down, um, but not lean them back a whole lot, leave them sitting up. Um, yeah, I would say in some kind of a rescue situation, it's not going to be that we can do anything other than like decrease the load on the heart. So sit down.
Hmm.
Just take a load off, right? Just sit down, stop doing whatever activity you're doing. I would say, let's try if there's a pulse oximeter in the house, put that on, see what their oxygen level is at, see what their heart rate is at. Um, Make sure that the oxygen is flowing properly. Maybe there's a kink.
Hmm.
Maybe we tried to refill the water humidifier cup and got it cross-threaded. And so the system has a leak in it and it's not really getting the oxygen to the client. Um, it can be, something like that. But the main thing is if we have that weight in the morning, that daily weight, then we're going to be able to head off some of those unknown things that could happen throughout the day.
Right.
Because we'll know, oh, you're doing okay or you're not. So if that person's 3 or 5 pounds heavier than they were or from their baseline, then we can expect that they're going to be having a little bit more issues, but hopefully we have some interventions in place that we can do. Like, for example, the doc might already have a plan in place that says, hey, if you're 3 pounds more, I want you to take an extra half of your Lasix or an
Okay.
extra half of whatever diuretic you have. If that one doesn't work, then maybe there's a second prescription that's a backup line that's like a heavy duty diuretic that
Okay.
really like we're going to bring in the big guns if you're 5 pounds over.
Mm-hmm.
Um, but if those aren't working and they're still having shortness of breath, then that's where maybe they're going to have to go back to the hospital again. But we're going to do what we can to maintain, help them keep their sodiums low um, and restrict their water to whatever it's supposed to be to try to maintain. That's the goal.
Okay.
Maintain.
Yes.
Stay on top of it. Yeah.
So did you have a story about?
Oh, I do. I do have a story. So, we were taking care of a gentleman who had congestive heart failure, and I ended up being with him this particular day. And I show up, and he's in his bed, and he's at his bed, and he's like sifting through all the blankets. He's just like looking everywhere for something. And I'm like, "Hi, what are you doing?" He's like, "I'm trying to find my cigarette butt. I dropped it in the bed somewhere."
Oh my gosh.
Well, he used to smoke, but he
Oh,
hasn't smoked for years. And I'm like, the house doesn't smell like smoke. There's no indication. Like something's, I think he's a little confused today, but he's really looking for it. And I'm like, this is interesting. So of course I like help him look. I don't see it anywhere. Um, And so I kind of try to reassure him. We go out to the kitchen and there's a little bit of a hallway, maybe the length of this room to get from his bedroom to the kitchen. And he's like huffing and puffing. Like he can barely make it. It's like taking all of his strength, his walker and everything to get out there. And he sits down at the table. And he is not willing to get on the scale right now. Like he just needs a minute, right? So I don't know his weight, but I'm guessing something's off.
mm-hmm.
Um, I'm trying to check his vitals, and the pulse oximeter is reading really, really low. Like I would think if it was in the 60s, there would be even more signs going on, but it's saying his oxygen's like 60. And I'm like,
Hmm.
I mean, like I don't, he doesn't look horribly pale. His lips aren't blue. He's still talking to me. He's still telling me what he wants for breakfast. I'm like, I don't, okay, your numbers aren't matching what I see with you, but something's up, right? So he had some circulation issues in his fingers. And so if his hands were cold, the pulse oximeter would not read properly. So I got a hot washcloth, warmed up his hands in the washcloth for 10 minutes or so, rechecked. Sure enough, it was like low 80s, right?
Okay.
His heart rate wasn't super high because he's taking a blood pressure medicine that also affects the rate of his heart. So that was a false regular number,
Okay.
right?
Yeah.
But that's part of the problem is that his heart isn't able to respond and compensate because normally the rate would go up, but it wasn't able to do that because of the medications were blocking that
Mm.
mechanism to be able to do that. So his oxygen was low, his heart rate was regular. I think his blood pressure was fine. But he's still really confused too, he's just like not making sense. We finally get him on the scale. His weight was up from what it should be. I think it had been gradually going up throughout the last couple of weeks. So it wasn't a huge jump for the day
Mm-hmm.
before, but it was definitely up there from his baseline. But um but the biggest thing he had was this confusion on top of the shortness of breath. And the confusion is coming from the hypoxia. The low oxygen over a long period of time is actually starting to affect his cognitive function. So he is not able to think properly and think clearly because he's short of oxygen.
Yeah.
So,
Starving his brain
yeah.
of oxygen.
Yeah.
Wow.
So, there wasn't a whole lot I could do in that moment, as far as fixing that. That was something that I don't think he wasn't on oxygen, if I remember right. So it's not like I could even turn up the oxygen. But we ended up calling the son and they took him in like non-emergently, took him into
Mm-hmm.
the hospital and he was in the hospital for 2 or 3 days and
Mm-hmm.
before he came back home. But
Did he come back on oxygen?
I think he did. I think he did a little bit for a while and then he was able to come off of it
Okay,
again. Yeah.
nice.
But
Yeah, that would be,
interesting.
yeah.
Yeah.
So
Okay, so
let's
take good
see.
care of yourselves.
Yes,
Eat right,
don't
right?
smoke.
While you're young, you got to do these things, right? Because they're cumulative effects. And once you get past the certain stage, there's not much you can do to reverse it. So, gotta stay healthy now. If we're learning anything from all these folks we're taking
Yeah.
care of, it's don't do what they don't do what they did. Take good care of yourself.
Mhm. And there's always room for improvement too,
Yeah.
and don't beat up on yourself because that doesn't help either. So
I know. Yeah.
just,
Little changes,
yes.
maybe. Just start
Yeah.
with a one good habit,
Hmm.
get that one worked through, and then try to add another little baby habit that's good for you.
Yeah. It'll get momentum
Yeah.
but good self-talk is always good
Seriously.
too. Just tell yourself that you're doing great and you love yourself because that actually makes a huge difference if you
Hmm.
talk to yourself nicely.
Yeah.
Hmm.
I need to do that more.
Yeah. Me too.
All right. So, hope you enjoyed this video and hope you feel more confident and knowledgeable about taking care of somebody with congestive heart failure. Now you understand a little bit more about what's going on. There's also a lot of really good resources on YouTube. I love pictures, and there's so many things on there that actually are great about explaining all the different types of things that can happen on the left side of the heart and that how that can affect the right. And then just basically what you need to remember is that congestive heart failure is going to cause things to just back up down the line um, and cause that fluid to not get to where it needs to get to. So,
Okay.
okay.
All right.
All
Thanks, you
right. Thank you.
guys. See you next time.